It's time for good energy, and I'm Dr. Julie, and welcome to Bodyful Day 258. We are talking about constipation in the senses, and today we are talking about the sense of touch. All right, today we're going to discuss, this is the last day on our series of constipation in the senses, and we're going to talk about how you can use the sense of touch to help with constipation, and how some receptors in the sense of touch can actually slow things down. All right, let's start this the way we normally do. Take a deep breath in and release. Take a deep breath in, expand in the belly, expand in the chest, expand in the sinuses, and tuck your tail, and then release. And since we're talking about the sense of touch, I want you to think about times when you've had cramping in your belly due to constipation, and you're going to breathe into that. Take a deep breath in and release. All right, so remember, this is day 7 on our series on constipation in the senses, and our goal is to have the energy to clear constipation, or the energy to be regular, equals good energy in minus stressors. And our goal has been to figure out how to use the senses, how the senses can be either as a good energy in or as a source of stress. And today we're going to keep up with the same concept as we work into the sense of touch. So this isn't anything new. We've kind of talked about these things before. We know that the sense of touch is temperature, vibration, and pressure. Temperature, vibration, and pressure. Those 3 things are involved in the sense of touch. And we have that sense of touch both outside our body as well as inside our gut. That can detect vibration, temperature, and pain, and pressure. And when you are experiencing constipation, there is pressure in and around your intestines. It could be in your small intestines. Most likely it's occurring in your large intestines. And so with the concept of pressure and possibly heat, could be, existing in your gut with constipation, we're going to work on 2 components of that. So the first thing we can work on is what I call the wheel. And the wheel is a massage approach that you use with babies who have constipation, but you can use it with the adults as well. And it's a 5-handed. So if you have a baby and they have constipation, you put your fingers on their abdomen and you end up with a wheel. So lower right hand, upper right hand corner, middle, upper left hand corner, lower left hand corner. The same thing can be done with the adult body. So you can, you can do that with your adult body. It's hard to put the hand there, but a hand will work if you imagine the hand in the right place. Your thumb and your pinky are acting as your lower corners. Your pointer finger and your ring finger act as the upper corners, and your middle finger acts as the middle. And you can do small circles, massage small circles in each of those spots, and you always start on the right side. So lower right, small circle. Okay, upper right, small circle. Middle, small circle. Left upper, small circle. Lower left, small circle. And you can do this over and over again and spend more time in the small circles. Use the sense of touch, use pressure from the outside to cause shifts in the sensory information on the inside. Essentially what you're trying to do is saying these are the 5 main locations where things can get gummed up. And you are using massage, which in a sense is kinesthetic, but also is a sense of touch. You're using massage to get in there and to move those major stuck areas in the large intestine. Now, are you going to hurt anything? You could press really hard and you might upset the appendix, you might upset an ovary if you have COPD. if your appendix is already inflamed, you might upset that. But for the most part, you're not going to push hard enough to make yourself fall over in agony. You just want to provide a little bit of good, gentle massage at each of those locations. And so, you know, you got a few extra things in different places, but the idea is you don't push hard. And so in doing that, you're giving a nice sensory amount of pleasure or pressure, enough touch sensation based on pressure to cause things to move. Now, with that in mind, the other way that you can move things along is with heat. Now, you've already heard, you know, for bygone along bygones, we've either had water bottles or hot packs or heating pads or warm stones. We as humans have been putting stuff over our gut forever because the heat causes relaxation of the muscles. And once the muscles relax, then constipation has a tendency to move through. So heat is a very good way to do that. Now, there is something that you could add. You could add a little castor oil. On the outside, I am not an advocate of taking castor oil internally, but you can add castor oil to the outside to help relax tissues and help with that general healing of the belly. Now, if you have an old 1980s cloth heating pad, you don't want to put your castor oil and then your heating pad on. So either some saran wrap, some plastic wrap, or what we do in our house for a little bit more durability, we take a plastic Ziploc bag and cut it open and then lay it over the top so that we don't get oil onto our heating pad. So you can use that to provide temperature, and then you can use the massage to provide touch, and that should help move things along. Now, just as an aside, in terms of the sense of touch, remember that compression in the wrong way. So compression, not when you're on the stool and you're trying to go to the bathroom, because we talked about, you know, bringing your feet up so that you had compression to push things in. But if you are trapped in a compressed position for digestion, that is not going to move things along. That is going to increase your constipation. So compression, enduring pressure on your belly is not helpful for constipation. That gets to our discussion previously about girdles and girdles, mostly, about girdles and tight jeans. You don't want to provide that much pressure because that actually slows things down. The massage actually encourages momentum. And of course, cold. The colder you are, the more we talk about, previously when we talked about cold extremities, we talked about drawing in of the blood into the core to do things rather than the exterior, but not to the core in terms of the intestines. It's core in terms of blood flow to keep the core running. So we want to make sure that you're nice and warm, and we want to make sure that there is flow, so not a lot of compression while you're massaging and using your heat, because you want stuff to move around your gut so that it will move where it needs to go. All right. I hope that this series has been, that you've picked up a few things in this series, and that you've enjoyed running through this series. Next week, we are running through a favorite stressor of mine, not a favorite, a consistent, I should say, a consistent stressor of mine, which is swollen cuticles, and how you can heal your cuticles and not have them rip them off with your teeth and all sorts of fun stuff that goes with cuticles. So cuticle chewing, cuticles, cuticle inflammation and infection. So we're going to cover the gamut of cuticles. So join me next week for cuticles and the senses. All right, let's finish this off. Take a deep breath in and release. Have a great day. I'll see you here tomorrow.